Hello, everybody. Welcome. Before we start, I just want to check to make sure that everybody can hear me. So if you can hear me, can you raise your hand? In the computer, you should have a picture, an icon of your hand, of a hand. Perfect. So I see a lot of hands going up. It's my first time doing an online webinar. I usually do all my presentations in person here at the clinic. So I'm actually kind of excited today for this. So now that I know that everybody can hear me, and in the screen, you should be seeing a slide with my picture and with the title, Keep Safe Against COVID-19. So again, if you are not seeing that, if you can please just write a question under the question icon and let me know. Okay, so I'm really happy that you've decided to join me today because it just seems like we're living in a wild, wild world right now. I have so much information to share with you. I decided to do this online webinar because I've been bombarded with really cool natural tips, that I thought would be really important to share with all my patients and with other people who may not be my patients necessarily, but may still be interested in this information. So because I have so much information, I did have to divide this up into two presentations. So today's presentation, we're going to be talking about more the nutritional aspect of our how to help our immune system through nutrition. And we're going to start talking about some of the supplements. But in the second presentation, which is going to be next week, next Wednesday, same time at 12 noon, I'm going to continue talking about more of the supplements, herbs and homeopathic remedies. And I also want to talk about next week for people that have allergies. I think this is a forgotten risk group, people that usually have the seasonal allergies, and their respiratory tract can be affected just naturally at this time of year. So I just want to address, and give tips for if this is you, what you can do, to try to improve things. Okay, I'm also going to be recording this session and I'll be making it available. So for anyone, maybe if you miss parts of it, or if you know anyone who you think may benefit from this information, then I will be sending out an email letting you know how you can listen to the recordings. Okay. Okay, so let's get started. So, there we go. So I think most of you know me, but for those of you who don't, my name is Dr. Sandra Miranda. I'm a naturopathic doctor. I have my clinic in Ajax. I've been practicing for 20 years. My main focus, at the clinic is working with women who have hormonal imbalances. I love treating those cases, and I teach a lot of classes, in those type of problems. Detoxification, weight loss, stress, anxiety, depression, menopause, PMS, anything to do with hormones. These are the type of cases that I love to treat. Understandably, the immune system is very much connected with hormones. So it is something that, of course, we focus a lot, in all my patients. But today's topic, just because of the COVID-19, is mainly focused specifically on just immune system, okay? So what we're going to be covering today is we're going to talk about what the typical course of illness seen in COVID-19 patients. We're going to talk about who's at risk, what are the current recommendations that hopefully all of you are already following. And then we're going to get into very specific dietary tips that you should be following to boost up your immune system, and supplements, that can help you. Okay. So what is COVID-19? COVID-19 is pretty much a coronavirus. Now, probably all of us here in the phone call has had a coronavirus infection in the past. There is a wide range of diseases that coronaviruses can cause. So for example, it can cause just a regular common cold, or it can be the cause of more severe diseases such as severe acute respiratory syndromes. So there is quite a big range of what coronaviruses can cause. This one specifically has been declared, of course, a global pandemic. This is a chart. I just wanted to give people a bit of perspective on the death rates of the different epidemics that we've had, in the past. So the Ebola virus, of course, was the deadliest one. The death rate was anywhere between 25 to 90%. Then you have the bird flu at 50%. SARS, which happened about 10 years ago, I believe, the death rate was 9.6%. The coronavirus, this COVID-19 that we're dealing with right now, is they're predicting it to be about 1 to 2%, although some sources say that it can be up to 5%. For the death rate. Now, the regular seasonal flu, the death rate is only 0.01%. So even though it doesn't seem like a big difference, it does make a big difference when we're looking at larger scale of patients and people being infected. Now, the good news is that 80% of people only get very mild symptoms. So the World Health Organization says that it's about the 80%, 81, 82% more or less, that can recover without necessarily having to go to the hospital, without necessarily seeing any specialist or anything like that. It's only about 1 in 6 of the patients that get infected with COVID-19 that can get seriously ill. So what is the clinical course? So normally, after you've been exposed to the virus, it can take anywhere between 2 to 11 days, on average 5 days, for you to start feeling flu-like symptoms, okay? So the more common symptoms that you can experience is usually a high fever, headaches, a dry cough. So if you have a wet cough, that's good news. It's probably not COVID-19. It's usually more, the presentation is usually more with a dry cough. Myalgia, which means body aches or back pain, nausea without vomiting, loss of smell. That has been indicated by a lot of people who have COVID-19 that they just lose their sense of smell. Of course, lack of appetite and feeling really tired. Less common, you have the abdominal discomfort with some diarrhea. Wheezing seems to be not as common a symptom, and dizziness, as well. Okay. So then by the 5th day, usually what people seem to present with is a bilateral viral pneumonia. So what's a pneumonia? It's pretty much inflammation in the lung tissues. And this inflammation is caused by damage from the virus. So the reason why this is important is because as we start talking about the nutritional aspect and the supplements that are usually recommended, understanding this role of inflammation that the viruses causes in our body will help us understand why the different supplements or the different dietary changes will be helpful, for us. The inflammation can affect our heart as well, causing problems such as myocarditis, pericarditis, even new onset congestive heart failure in some people. And then if things don't start getting better, by the 10th day, we get something called the cytokine storm syndrome. So when our body starts, when we have inflammation, what's being released is what we call inflammatory cytokines. So if the inflammation is not controlled, then a variety of inflammatory problems in different parts of your body start resulting in what we call an overwhelming systemic inflammatory problem. So that can start creating multiple organ failure and potentially death. So this is the stage that we really want to try to avoid, okay, if you are infected. There's also blood work that, of course, you know, if you go to the hospital, they're going to do blood work. Usually what's seen is they see low white blood cell counts. They see your inflammatory markers being elevated. They can see your liver enzymes being elevated, things like that. So who is at risk? Of course, everybody knows older people are more at risk. But now that doesn't mean that the younger crowd should not be careful, because even though it seems like in China and in Italy, which were the two epicenters from not too long ago, it was very clear that the elderly people were the ones more at risk. Now we're seeing here in North America that a lot of the younger crowd can, of course, still get infected and can still, you know, get the severe illness, you know, and that cytokine storm release. So just because if you're not older, you know, you still need to be careful because it can still affect anyone. Of course, people that have respiratory, like pre-existing respiratory problems are at risk. So people that have asthma, for example, diabetes, heart disease, because the virus seems to affect not only our respiratory tract, but also our vessels. People that have cardiovascular risk factors also need to be careful. So people that have high blood pressure or a past history of heart problems. If you're taking immunosuppressive medication, you want to be careful. If you're dealing with active cancer, you need to be careful. Or I would even add to this category, people that have had cancer in the past 5 years. Technically speaking, for an oncologist or a medical doctor to say that you're in full remission from a cancer scare, you need to have gone through 5 years, you know, being cancer-free. So I would even include in people who are at risk, people who have had cancer, you know, over the past 5 years. And if you're taking any treatments like chemotherapy, then of course, all that weakens your immune system. So you would also be at risk. So how does the virus spread? The virus spreads just like a common cold or a flu. So if you're right next to a person who coughs or sneezes, then, and if those droplets get to your eyes, to your nose, or to your mouth, then, you know, you have chances of getting infected. Or if the droplets land on these surfaces, you know, where people are touching, and then you happen to touch that surface and then touch your face, you know, your eyes, your nose, or your mouth, because those are the main routes of entry, then you can get infected, you know, as well. Now, it's not clear as to how long viruses are viable in surfaces. You know, you hear, you know, from 2 hours to 72 hours. You know, they say that maybe in metal, you know, surfaces and in plastic surfaces, the virus can stay more viable than in other surfaces. Other people say that, you know, I've heard that even though the virus is there in the surface, it doesn't necessarily mean that you can get infected with it because it's already a weakened virus, you know, what's left in the surface. So it's not very clear, you know, as to how long viruses can stay in surfaces and whether they can, you know, make us sick or not. So for now, the best thing is just prevention. Okay, so what are the current recommendations? And I'm hoping all of you are already following this. The reason why I'm going through all this is because all the natural tips that I'm going to be sharing with you, they need to be only supplemental tips to what the current recommendations are already in place. So that's why I thought it would be important to let's just review, you know, what the current recommendations are, and just know that everything else that I'm going to be talking about, it's just extra. Okay, supplemental to this. This is the main part. So of course, the main thing is regular hand washing. You know, I'm sure every single one of you is now you're probably washing your hands a lot more frequently than what you ever did before. And you want to wash your hands for longer. So, oh, that should be 20 seconds, by the way, that's not 20 minutes. So regular hand washing for 20 seconds. So you want to be able to sing the happy birthday song twice. So you want to make sure that you're washing your hands really, really well. Of course, using a hand sanitizer, please make sure your hand sanitizer has at least 60% alcohol. That's usually what's recommended. And the hand sanitizer should not be replacing you washing your hands. So you're just using the hand sanitizer until you're able to get home and wash your hands, okay? You want to, of course, avoid touching your eyes, your nose, your mouth without washing your hands first. You want to, just practice disinfecting surfaces often, especially those that get touched by people a lot. So door handles, phones, your cell phones, you need to make sure that you're cleaning those regularly, keyboards and light switches. Okay, so pretty much COVID-19 will pass. We are going to get through this, but the speed at which this is going to go away is really just dependent entirely on our behavior as a community. So that's why all of these recommendations are really, really important. Okay, so other recommendations is physical distancing. So we want to be at least 6 feet apart. You want to avoid, right now, handshakes and hugging and standing or sitting close to people who are coughing or sneezing. If you do use a tissue to cough or sneeze, please put it away in the garbage. Just throw it away in the garbage right away. You want to stop non-essential travels, and you want to get tested if you develop symptoms. And I'm going to be sharing at the end. Somebody was asking if we have mild symptoms, whether we can just treat it at home. So I'm going to share with you at the end some resources, and websites where you can go in and get more guidance as to whether you should be going, to get tested, or if you're okay to stay at home. Okay. Okay, so now with the natural therapies, the goal of using, these natural treatments is can we boost up our immune system well enough so that if we do get infected, with this virus, that we can prevent a severe case. And of course, if we can prevent it turning into that cytokine storm syndrome or associated pneumonias, okay? So now I do have to say that none of the integrative or natural tips that I'm going to be sharing with you has been validated in human trials or clinical evidence-based trials. So pretty much the information that I'm sharing with you, it's either coming from in vitro evidence or just from in general understanding the virulence of COVID-19 and other coronaviruses. Or just from general naturopathic data that we have in treating viral infections, and also just general naturopathic philosophies that we've been using for years, to help people, boost up their immune system. Okay. Okay, so any questions so far before we get into the nutritional aspect? Just gonna check here to see if there's any questions. If you have any questions, there should be a question mark icon that you can click on your screen, and then you can just type in your question there. Okay, so I don't see any new questions. Okay, so let's just keep on going. If you have any questions, just write it down. Okay. Okay, so let's start with the diet. So the very first thing that you need to avoid is junk food and fast food. Why? Because it's devoid of nutrients, okay? In developing countries, the biggest reason why we can get severely ill from an infection is because people have weakened immune systems from a lack of nutrients, okay? So, we always should be looking at food as our medicine, Okay. Right now that we're all staying at home, one of the biggest problems I find with patients is that everybody's eating a lot more junk food. You know, we're all just at home, we're just sitting around, we're watching TV, we're not doing much. So it's a lot easier to go and grab, you know, that bag of potato chips, you know, all those sweets, you know, and everybody is eating a lot more junk food than what they normally will. So please be careful, you know, with that. Because if you start filling up with all this junk food, then you're not going to be eating, you know, the healthier foods that are going to give you all the nutrients. So the idea is to eat more whole foods and nutrient dense foods. So the way you find things in nature, that's the way you want to eat it. Okay. And the more colorful your plate looks, so I'm talking about the green leafy vegetables, or like the yellow peppers, or the red tomatoes, or the orange peppers, or the carrots. So you want to have a lot of colors, you know, in your plate. And what that's going to give you is a lot more phytonutrients. Phytonutrients, those are the antioxidants, those are the flavonoids. We're going to talk about all this, that are going to help with your immune system. Okay, so lots of color. Okay, so vegetables and fruits, they have something called flavonoids. Flavonoids is like an antioxidant, but the flavonoids is what's going to help reduce inflammation. Okay, so a very common flavonoid that you have probably heard about is quercetin. Quercetin is primarily found in onions and apples, although it can be found, you know, in other vegetables as well, and other fruits. The other common one that you probably are familiar with is curcumin. Curcumin comes from turmeric. So a lot of people are probably cooking with turmeric, and that's a fantastic anti-inflammatory. Okay. The green tea, I'm going to get more into green tea, but green tea has a main ingredient called EGCG, and that can be extremely helpful. So in a future, and I'm going to get to a slide where I'm just going to talk about green tea. Okay, so lots of fruits and vegetables. So how much of the fruits and vegetables should you be having? You know, some people have 3 cherry tomatoes and they're like, oh, I'm fine, that's my vegetables, you know, for the day. No, that's not enough. So for fruits, you know, a good 2-3 servings per day is a good amount. But for the vegetables, you want to make sure that you're having a minimum of 2 cups at lunch and a minimum of 2 cups at dinner. Okay. So, and please make sure that you notice that I say minimum. So if you want to have a bigger, some people are great, you know, eating their green salads, you know, and if you want to have a really big serving of a green salad, nothing wrong with that, but you should always aim for a minimum of those 2 for lunch and for dinner. Okay, because that's going to give you the necessary flavonoids. These are really good liver cleansing vegetables. So what do I mean by that? Our liver is the organ of detoxification, and all of these vegetables that are in your screen right now, so if you can't write it all down, take a picture of it, is going to help your liver to detoxify, because we all are exposed to toxins. There's no such thing as being completely toxin free. So we're always looking to see how can we help our liver detoxify so that we can have a lower level of toxins in our body. And when we achieve that, then our immune system can be stronger so that it can be ready to fight off, you know, any other viruses that we may be exposed to. Okay, but if your body is really toxic, you know, and you have a high level of body burden of toxins, and you're not drinking your water and you're not having regular bowel movements, so we're going to get to all this, then your immune system is all busy trying to detoxify and trying to clean up your system, right? So then in a system like that, if you're exposed to the virus, so can you see how that would make it a lot more difficult, you know, for your body to fight off, you know, a virus such as this one, okay? So, so lots of green leafy vegetables. Beets are excellent for the liver. You can either steam them, you can bake them, you can just, you know, add them raw, you know, in a salad. Carrots are great. Green tea, again, you know, comes up again. Garlic, cauliflower, turmeric. So all of these things are hopefully things that you have at home and that you can start using on a regular basis. Okay. Okay. So, so mistake number 2 is people many times are lacking protein. Okay. And this is something that I find for all of you who are my patients, I probably have talked to you many times about having enough protein. But if you're not my patient, I don't know if you've ever thought about how much protein you're having in your diet. Okay. People are always thinking about the things that they need to eliminate, and sometimes they don't really put a lot of thought, you know, into things that need to be added, you know, to the diet. So protein, for usually we need to have at least 3 servings per day: breakfast, lunch, and dinner. Okay. And that includes breakfast. So I need to emphasize that because I find a lot of people skip breakfast. Or if you're having breakfast, you're just having a cup of coffee, or you're just having a coffee with a toast with a little bit of peanut butter. That little bit of peanut butter doesn't give you enough protein. Okay. So the way you can calculate how much protein you should be having is with this formula. So for those of you who are not vegetarians, what you want to do is you want to take your weight in pounds and convert it into kilograms. So you do that by dividing it by 2.2. Okay. And that gives you more or less the number of grams of protein that you should be having every day. Okay. Again, if I'm going too quickly, please take a picture of this slide. Okay. If you are a vegetarian, then you want to take your weight in pounds, convert it into kilograms by dividing it by 2.2, and then you take that number and multiply it by 0.8. And that is going to give you the number of grams of protein that you should be eating per day. Okay. So, and you want to take that number and divide it up into 3 servings. So for example, if it works out to be that you need 60 grams of protein per day, then you want to make sure you're having 20 grams at breakfast, 20 grams at lunch, 20 grams at dinner, more or less. Okay. So what is 20 grams as an example? If you're not a vegetarian, 3 to 4 ounces of chicken, of a chicken breast, you know, which is about the size of your palm, is equal to about 20-25 grams of chicken, of protein. Okay. The same thing for like a lean cut of beef or turkey, or for example, 2 eggs. 2 eggs equals about 15 grams of protein. Okay. So what I would highly, highly encourage you to do is write down for a couple of days. Maybe you can do it out of memory, or you can do it in the next 2 days. Write down exactly what you're eating throughout the day. Okay. And then at the end of the day, if you don't know how much protein is in everything that you're eating, you can easily just check the containers. Or if you don't know, you can always go to Dr. Google, you know, just Google how much protein in beans, how much protein in walnuts, how much protein in my peanut butter, you know, and Google can help you with this. And maybe just go through this exercise for 1 day or 2 days, just for you to get a bit of an idea how much protein you're having. Okay. So this is really important, because with a lack of protein, this is something that's so easy to fix, and it can have such an impact in our immune system. I've seen this many times. People that get into these crazy diets, they're trying to lose weight, and then all of a sudden they start getting a lot of colds and flus, you know, and it's because their immune system is weakened. Okay. So if you have any questions with that, you can let me know. Okay, so then the next advice is to spice it up. So you want to make sure that when you're cooking that you're using a lot of spices, okay? So you want to add garlic or onions or ginger, again, the turmeric, the oregano, or a lot of you have probably heard me talk about oregano oil, you know, being a great antimicrobial. So oregano oil, has antiviral, antibacterial, antifungal properties. So it tends to be my go-to. If I feel like a bit of a scratchy throat, or I feel like, I've been with a patient who's been coughing and sneezing in front of me, then I'll go home and take some oregano oil. So that's more in a supplement form, but you don't have to take it as a supplement form only. You can just make sure that you're cooking with oregano, and then you'll be taking in all those benefits, just through your food. So all of these spices, many of these spices have like different antiviral, antibacterial, anti-inflammatory properties. And I think it's a good idea for us to try to get used to all these herbal spices, as opposed to sticking so much with our salty and sweet tasting foods that we're so used to, and makes us continue craving, all the junk foods. So getting used to all these new spices has many benefits, not only for your immune system, but for many other things, as well. The other thing, if you haven't gotten some, then I would encourage you to go and get some shiitake mushrooms. Shiitake mushrooms, just like many other medicinal mushrooms, are amazingly important to support our immune system. And this is because they have a main ingredient called beta glucan. And what beta glucan does is it upregulates our first line of defense of our immune system, okay? So what it's basically doing is it's helping our immune cells, our white blood cells, to bind to the viruses and killing them as soon as it comes into our system before they're able to attack our cells, okay? So it helps that first line of defense. So if you're normally eat mushrooms, but you're getting more of the regular mushrooms, maybe next time consider getting the shiitake mushrooms, okay? Okay, now, of course, I've been kind of talking about sugar, being something that we need to avoid, but studies are very clear with sugar. They suppress certain cells of our immune system for hours after ingesting it. So for example, there was one study that I saw that 1 teaspoon of sugar can suppress our immune system for up to 12 hours. So again, think about it. So if you're just at home eating junk food and having all this sugar, and then you have to go out to the grocery store, to the pharmacy, or something, and you just happen to be exposed, to the virus. And if your immune system is depleted, then not very good, right? So if you're trying to stay away from the sugar and trying to eat more of the whole foods, then if you do have to go out and you do end up being exposed, then your body can, try to kill the virus before it becomes all systemic, okay? So limiting starch and sugar will help your immune system function better, and your overall health, improves. At the beginning, if you are eating a lot of sugar, at the beginning, it can be hard, to stop, because your body's going to crave it. Sugar is like a drug. Sugar shouldn't even be considered a food item. But I promise you, if you do stop having it after like 3 days or so, most people get into what we call ketosis, which means your body starts using more glucagon as opposed to insulin, and your cravings, your appetite should start decreasing, okay? So this is the best time for you to start, trying to eliminate, this junk food and the sugars, okay? So what are healthier alternatives? If you do want to sweeten something, I would use more things like honey, agave, pure maple syrup, stevia. There's another fairly new one called monk fruit, which is okay as well. But even if you're going to be using these healthier sweeteners, the recommendation is still to have only about 1 teaspoon, of them per day. Because if you start having too much honey, too much agave, too much pure maple syrup, then you're just going to continue craving sugar. Okay, so, but if you do want to sweeten something, then these are the healthier choices, and you want to try to limit it to 1 teaspoon per day. Okay. So the next thing that we want to avoid are the simple carbs. Simple carbs come into your body and turn into sugar. Anyways, most of these simple carbs are made with gluten, Gluten can be very inflammatory. And what we're trying to do is we're trying to create an environment with the least amount of inflammation so that if you do get exposed, to the virus, then your body is already in a healthier state versus, somebody who is eating all this junk food and gluten and sugar, and their bodies is more inflamed, okay? So what are healthier carbs? The healthier carbs would be, if you want to eat bread, any sprouted, bread. So Ezekiel bread is just an example of a sprouted bread. Nowadays, there's many other companies that have come up with sprouted bread. So all you would have to do, usually they're more found in the health food section at the superstore or at Sobeys or in any health food stores. Ezekiel bread, for example, is a frozen bread. Okay, so if you haven't tried it, I would highly encourage you to try it. I think it's a nice tasting bread, but it is a frozen bread. Okay, anything that's sprouted is going to have naturally occurring enzymes to help you digest the carbs, and the gluten that's there. Okay, so it's a lot more hypoallergenic type of bread. Quinoa, I don't know if all of you have tried quinoa, but if you haven't, this is probably a good time to try it. Quinoa is high in protein, and it's considered a complex carb, so it's a good carb. Wild rice or brown rice or basmati rice are the better types of rices. Those are gluten-free options. The wild rice is actually the one that has the higher amount of protein. So for example, having like a big green salad with just a cup of cooked brown rice, wild rice, that can be considered a full meal because a cup of wild rice gives you close to the 20 grams of protein. So that's how much protein it actually gives you. If you're going to eat noodles or pasta, there's so many different options nowadays that are gluten-free. So for example, one of my favorite ones is lentil pasta. So if you do okay with legumes, so things like beans and chickpeas and lentils, you can try the lentil pasta. There's also a quinoa pasta, which is very nice. So, so those would be different, ones to try, okay? You want to avoid the carbonated drinks. Carbonated drinks are full of sugar, plus many other things that are probably not good for our immune system anyways. So as an example, they say that 1 cup of pop of Coke, can have 12 teaspoons of sugar. So again, we talked about how 1 teaspoon of sugar can suppress our immune system for up to 12 hours. So if you're having just 1 glass of Coke, which is going to give you approximately 12 teaspoons of sugar. So can you imagine, the effect that can have in your immune system? So just not a good idea. So what should you be having instead? You should be having water, okay? So good old water. So the way you calculate how much water you should be having for your body is right here. I'm just going to try to circle it right here. Okay, so what you do is you take your weight in kilograms. So again, most of us, we know our weight in pounds. So you would take your weight in pounds, divide it up by 2.2. That's how you get your weight in kilograms. Okay, and then you're going to times it by 0.03. And that gives you the number of liters, the minimum amount of water that you should be having. Okay. As a rule, if you don't want to do these calculations, then you can just kind of aim for the 2 liters minimum. Or what I tell a lot of my patients is aim for 2.5 liters, so that if you get to 2, it's still a good day. Sometimes if we aim for 2 and we end up having 1 or 1.5, we're still, short, right? And why is water so important? For many, many reasons. First of all, as you can see here, 75% of our body is made out of water, okay? So our lungs, our immune system, our heart, everything needs water. It's an easy way of keeping our body flushed. So if we are eating or if we are exposed, to toxins, then if we're able to flush that out, that's going to keep our immune system stronger and ready to fight off any any infection if we do get infected with anything. And most importantly is if you think about how we can get this virus is through our nose, our eyes, and our mouth, right? If our mucous membranes, for example, in our nose are all dry because of us being dehydrated, then our body is not having that first line of defense. So in the mucosa of our nose, for example, and the same thing with our mouth, we have little antibodies that can come and bind to the virus, you know, preventing it from coming into our systemic system. Okay, but for that to be working properly, we need our mucosa membranes to be hydrated. Okay, so so there's many different reasons why it's so important, and I can't emphasize this more. And it seems like something so simple, and you're probably going to think, oh yes, I've heard that before, but this is really important. Okay, and we're at home and water is available to us. It's not like toilet paper, you know, we're not running out of water. So we're all have this this wonderful liquid, you know, to our, you know, in our fingertips that we can just drink, and instead of having anything else that's more sugary, like any other sugary drinks. So please, you should always be keeping up with your water, but especially right now. Okay. Oh, and I think we have a question. So let me see. Okay, I think it's Enid. Oh, we have a few questions actually. Okay, so first of all, how long do mild symptoms last? I'm not sure if I have a specific answer to that, Maureen. I've heard people that say 1 week, 2 weeks. Again, it depends. And even if it does take a little bit longer, if it's not progressing into the pneumonia and that cytokine storm syndrome, then, you know, you just keep on doing what you're doing. So I'm not 100% sure. I haven't heard of an average, you know, number of days for the mild symptoms, you know, to last. The clinical outcomes that I was presenting to you at the beginning of the presentation, it was more like what's seen, you know, when people get admitted, you know, to the hospital, you know. So it usually, you know, after interviewing and questioning, you know, usually what they find is that it takes about 5, you know, days for the symptoms to start appearing, and then it turns into, you know, the pneumonia, and then the overwhelming systemic inflammatory problem, you know, which is what the problem is. Another question is, why do other countries use more natural remedies than in North America? That is a very good question, and I'm going to talk a little bit more about that when I get to the supplements. I don't know, there just seems to be a bit of a resistance, you know, for North America, and I think it's both. I think it's the States and Canada, both together. For using more natural remedies compared to Europe or other parts of the world. So I'm not sure, but it's very true. It's a true observation. You know, you know, doctors, especially at, for example, one of the things that I'm going to be talking about in the second session is vitamin C. You know, and how useful vitamin C can be. Especially when given intravenously. So in Europe, a lot of the hospitals were using IV vitamin C, you know, to treat these severe cases with some promising results. And I'm not sure if in North America they're going to be open, you know, to doing something like that. I hope so, but we'll see. I guess only time will tell. Who else? We have Libby. Wondering if you have hypertension, but it is controlled with medicine, if it is still a risk factor. If you have hypertension that's controlled, then it's less of a risk factor. But, you know, just like with everyone else, I would still, you know, try to be careful. But if it is controlled, then it's not as troublesome. Let's see, another question. Do you have any information about people who are on the keto diet? with healthy fats, not just bacon. Okay, so it's like a clean keto, and their immune function. So Darren, there is so many different diets out there. There's the paleo, and there's the keto, and there's the South Beach, and there's the Atkins, and there's, there seems to be, just depending on the month of the year, kind of like a new trend, of a new diet. What I tell all my patients is that what's common about all of these diets is that they all ask you to eliminate sugar, processed foods, and junk food, and they all encourage lots of water and a decent amount of protein, right? Which is what I'm presenting here. So my guess is that if you're following a keto diet, as long as it's a clean keto, just like what you're saying, so don't start wrapping everything that you're eating with bacon, or don't start putting whipped cream in everything that you're eating, then my guess is that that would be a good diet, to keep your immune system healthy. Okay. Do you have any recommendations, information on the super green supplements? Okay. So yes, greens is something that I love to recommend, all the time. I try to encourage my patients to actually have green juices, something that you can make at home. So for example, in a blender, you can add some spinach and cucumbers and celery and maybe some green apples just for flavor. And then you can make your own, green smoothie. So why not? But some patients, they don't have the time, or they don't want to bother, or they don't particularly like, the green smoothies that are made at home, and they prefer to go to the health food store and just get like a greens supplement. Okay, and that is an okay idea, except that you want to be careful that some of these newer companies that are coming up with greens powders, they're adding a lot of fruits, so they end up being more fruits than greens, because, and they do that because obviously they want to try to improve the taste, of the powder. So you just want to make sure that you check the ingredients and that you're choosing one that has mostly greens and not so much of the fruits. Okay. Okay. So, okay. So I think what I'm going to do is I'm going to keep on going with the presentation, and then at the end, I'll try to answer all the other questions. So, okay. Oh. Okay, so again, talking about the water, we want to make sure that you start your day with water. So it's a good idea as soon as you wake up in the morning to start your day with 2 glasses of water and lemon. Okay. If you don't have a gallbladder, then having the lemon is not 100% necessary. You can just start your day with water. If you have heartburn or acid reflux, then maybe you want to skip the lemon, because you probably want to be careful with all the citrus fruits anyways. But starting your day with water, if you don't have any of the problems mentioned earlier, then if you can add a little bit of lemon is a really good idea. What I do is I prepare my 16 ounces of water, at nighttime, bring it upstairs to my bedroom with me as soon as I wake up, before I even go to the bathroom, before I check on the kids, before I check on the dogs, before I go downstairs, anything at all, I'm having my water. Okay, and right there you have 2 glasses out of the way, which is 16 ounces. Okay, so it's a really, really good recommendation. Okay, so the next thing that I want to talk about, which is probably one of the hardest conversations that I need to have with my patients, is try to limit caffeine. Okay. So if you're just having the 1 cup of coffee per day and you're drinking your water, you're probably okay. But if you're having more than 1 cup a day, or if you're currently dealing with a lot of anxiety, I know at these times can be, there can be a lot of anxiety, that people are feeling, caffeine will affect your nerves. In fact, caffeine affects every single organ, in our body, including our immune system. So having 1 cup a day, as long as you're drinking your water, and you're getting hydrated, during the rest of the day, that's completely fine. Try to avoid having any more than that. What can you have instead? If you guys don't know, there's the Swiss water process decaf type of coffee that you can have. So regular decaf is not a good alternative, because in the process of removing the caffeine, they're adding chemicals. So you might as well just enjoy your regular cup of coffee instead of having the regular decaf. However, this company called Swiss has found a way of removing most of the caffeine from the coffee without any use of chemicals and only with a steaming process. So it's not 100% caffeine free, but most of the caffeine has been removed. It still gives you that taste of coffee. For a lot of my patients, they don't want to give up their coffee because they just love the routine and they love the aroma and they love the taste. The Swiss water decaf will still give you all of that. The other option is the green tea, which again, I keep on saying this, we're going to talk more about, but it's something really healthy for us, okay? You want to limit the amount of alcohol, you know, as well. Alcohol affects the interaction between our gut and our immune system. So what happens is that when we're drinking alcohol, it disrupts the gut barrier, allowing the viruses that are coming in to more easily come into our bloodstream, okay? So again, I'm not talking that one cup of wine, that one glass of wine that you may have on a Saturday night. That's not what's going to affect your health. What's going to affect your health is when you're having more than one per evening. So if you're having 2, 3, or 4, which a lot of people can have per sitting, or if you're having it more often than maybe twice a week, okay? So some people get into habits of, you know, coming home, or right now you're just at home, or just while you're cooking or with dinner, you're having easily 2 glasses, 3 glasses. That's what's going to affect your immune system, okay? So again, having a moderate amount once a week, twice a week, try to limit it to 1 glass and try to drink a glass of water right after so you can flush it all out, you know, quicker. That's fine, but you want to avoid drinking more than that, especially during these times, okay? So what's a good alternative? I don't know if you guys have tried kombucha. Kombucha is still fermented. It tastes a little bit like wine, although some of my patients will say no, it doesn't, but I think it does. This one is my favorite type of kombucha. You don't have to get this one specifically. You can get any kombucha. Kombucha comes from green tea. It's fermented. It doesn't have the alcohol, but it still gives you that calming effect, you know, that a lot of people are looking for, you know, when they drink alcohol. So, and the extra benefit of kombucha is that it's fermented and it has the good bacteria, you know, in it. So just like, for example, you know, eating sauerkraut or kimchi. I don't know if you guys have tried kimchi. It's a Korean dish. It's really delicious. Miso soup, it's made out of soy. Tempeh, made out of soy as well. Kefir, if you can't do dairy, then you can do like a coconut kefir. All of these are examples of fermented foods. Fermented foods are going to give you the good bacteria for your digestive tract. And our digestive tract, 70% of our digestive tract is actually connected to immune system. Okay, so the health of our digestive tract is very much connected to the health of our immune system. Okay, so having some of these foods that are going to give us the good bacteria will help our digestive tract, hence our immune system. Okay. Okay, so this is a non-alcoholic Quarantini. I actually heard of Quarantini from one of my patients, and I think she's actually here today. So I was looking for a recipe that would be good for our immune system that doesn't have the alcohol, you know, and this is what I found, and it's quite delicious. So if you want to use 2 apples, 4 oranges, 1 lemon peeled, some ginger, some turmeric, and some water, you just blend it all together, and it makes an amazing drink to boost up your immune system. Why? Let's think about it. The apples give you the quercetin, the flavonoids that are really good for you. Oranges and the lemon gives you the vitamin C, okay? Vitamin C, you know, gives you, again, I'm going to talk more about the vitamin C in the next seminar, but for you to know that vitamin C, when you take some vitamin C either in supplement form or in a drink like this, it boosts up your immune system for the next 4.5 to 5 hours. Okay, so this would be a great drink, for example, if you're thinking about going out somewhere, you know, because you need to get some groceries or you need to go to the pharmacy, or you want to go out for a walk, or maybe you need to go and get some blood work done. Like, who knows, whatever the reason may be that you need to leave your house, maybe have this drink right before leaving your house, you know, so that you can have a stronger immune system while you're out. Okay. But drinking this every day is actually, you know, a good idea, you know, and for many different reasons. So again, if you can write it all this down very quickly, take a picture of it. Okay, so let me see any more questions. Or actually, I'm going to just start talking because we only have 5 minutes and I want to try to make sure that I get this information in on the supplements. And then at the end, I'll answer the other questions. And if for those of you that need to leave right at 1 o'clock, then you can just, at least you have all the information, okay? Okay, so one of the first supplements that I wanted to talk about today is zinc. Zinc can be found in a multivitamin. Zinc can be found in a supplement on its own, you know, as well. Sometimes it's also found in supplements that are just multi-minerals, you know, zinc, you know, may be included. By the way, I'm going to start talking about different types of supplements, and in the next talk, we're going to talk about herbs and homeopathic remedies. I don't want you guys to go out and start buying every single thing that I'm mentioning, okay? The reason why I'm suggesting, and I'm going to be talking about all of these different supplements, is what I want you to do is I want you to go to your cupboard, check to see all the supplements that you have, and maybe try to prioritize, you know, what you're going to be taking right now, okay? So zinc, many studies show how zinc can help with the immune system. Zinc, if it gets into, if we're able to get this zinc into our cells, then what happens is that if we are exposed to the virus, then it's going to stop the virus from entering the cells. It can also help to decrease the virus replication, okay? So it helps in many different ways. But the effects of zinc is enhanced if you take quercetin with it, or if you take the green tea with it, okay? So there's some products that actually come zinc, quercetin, and green tea, you know, all together, which would be amazing if you can find that. If not, what you can do is maybe take the zinc at the same time as taking the Quarantini drink, you know, as an example, because that has the apples. Okay, or if you're having a meal, you know, where you're eating, you know, where it has some onions, then maybe take the zinc at the same time, or maybe take the zinc with a green tea, no sugar, of course, you know. So that's what I want you to start thinking about. If you don't have a zinc supplement on its own, then you want to try to make sure that your multivitamin, you know, has a good amount of zinc. So how much zinc should you be having? It depends on the type of zinc that you're taking. So zinc picolinate is better absorbed. So a good dose for zinc picolinate would be anywhere between 10 to 15 milligrams, you know, per day. If you have the zinc citrate, which is just as good, but that one is not as well absorbed, so you may want to do a little bit more. So anywhere between 20 to 50 milligrams, you know, per day. So if, for example, you have a multivitamin and the multivitamin gives you only 5 milligrams each capsule of the zinc picolinate, then maybe think about taking 2 multivitamins per day or 3 multivitamins, you know, per day, that type of thing, okay? So, and like I said, have it with the green tea or have it with some onions, some apples, or if you have a separate quercetin supplement, then you can do that too. Okay. So quercetin, you know, is a flavonoid. So I kind of mentioned that. The flavonoids are like antioxidants, you know, found in fruits and vegetables. It increases the action of the zinc. So when combined with zinc, great to take pre-infection so that the cells can be better prepared for any possible infection of the virus. And a good dose of the quercetin would be anywhere between if you're actually taking it in supplement form, can be anywhere between 500 milligrams and 900 milligrams per day. The picture, Natural Factors is a company that I think makes good products. You don't have to get the Natural Factors. This is just a picture that there's no specific reason. This is just an example. So it can be any company, you know, if you have Sisu or if you have a New Chapter, any of those are just as good, okay? Okay, so green tea. You may be able to find supplements made out of green tea extract, or it may be labeled as the EGCG, which is the main ingredient, the main active ingredient of the green tea. So again, it has excellent antiviral activity. It prevents the virus from attaching into the cell. So again, and it increases the function of the zinc, as well. And that would be a good dose, anywhere between 700 milligrams to 1400 milligrams daily. If you don't have the supplement at home, then don't worry about it. You can try to drink more green tea, during the day. Definitely have some green tea together with the zinc, when you take your zinc or your multivitamin. And the other benefit of having just a regular green tea with no sugar is that that's considered part of your water intake. So that'll keep you hydrated as well. Okay, so lots of green tea. Okay, so the other option is zinc lozenges. Again, the picture Sisu is just an example of a company that makes zinc lozenges. You can probably find many other companies that have this. You may have this at home already. So zinc lozenges are very popular. You've probably taken it, in the past when you have a sore throat. And the studies show that is specifically beneficial when the zinc lozenges come from a zinc gluconate or a zinc acetate source. So you can check if you do have some zinc lozenges, or if you are going to go and get some zinc lozenges, then just make sure it's a zinc gluconate or acetate, because those were the specific ones studied. Okay, so melatonin, I found this to be a really, really interesting supplement, actually, because the age-related decline in melatonin production is one of the proposed mechanisms to explain why children don't appear to be, as affected by this virus. So as the same way as older people do. So pretty much as we get older, our melatonin levels decreases, right? This is just a natural progression. And that seems to be in part the reason why older people seem to be getting more severe cases, than younger people. So I thought this was fascinating because this is so easy to fix, right? Melatonin decreases that inflammatory cytokines, which is what we're looking for. It also reduces the damage and the inflammation to the lung tissues, which I thought was pretty remarkable. How the actual dose varies a lot from people to people. Like some people, I usually prescribe the melatonin when people are having problems sleeping. So for those of you that don't know, melatonin is a molecule it's a hormone that increases in our system at nighttime, giving us the cue it's time to go to sleep, okay? When people are having problems sleeping, we may choose to give them some melatonin, before they go to bed. A regular dose can be 3 milligrams or 2 milligrams. Some people do better with just 1 milligram, right? Cancer patients, they use melatonin at higher dosages because it has been shown to decrease the replication of cancer cells, when you have high levels of melatonin in your system as well. It may be in part due to this decrease in inflammatory cytokines. We don't know, but it's a possibility. So the 20 milligrams at night dose that you see there in the slide, that's usually more for cancer patients. If you're just having some extra melatonin at nighttime to get into a deeper sleep, usually the recommendation is not to go that high, okay? Now, the more common side effect of melatonin, and it's like maybe 1 to 3% of the population can't take melatonin, and it's because it gives them nightmares. So if you do have melatonin at home, and if you start taking it and you end up getting nightmares, then unfortunately you're in that 1 to 3% of the population. Some people have said that if you go a little bit higher on the dose, that the nightmares can go away. I'm not 100% sure. I haven't seen that clinically. Usually when I have patients with that side effect of the melatonin, I just stop, the melatonin, and we use other stuff other supplements to help them sleep. But so keep this in mind. If you're having problems sleeping, if you feel like as years go on, your sleep has been lighter and lighter and lighter, it could be that your body is lacking some melatonin. Okay, if that's the case, then maybe this would make more sense, for you right now. You don't have to take it during the daytime. All you would have to do is take some before going to bed. Okay. Okay. So how to access a COVID-19 testing. So I believe it was Martha, somebody was asking whether I have mild symptoms, what should I do? Take a picture of this link. There's a self-assessment tool that you can just go in and you can type in your symptoms, and it gives you a better guidance as to what you should be doing, okay? If you're still in doubt, what you can do is always just call telehealth. Okay, so 1-866-553-7205, and ask them, as to what you should be doing. If they do direct you to an assessment center, please don't go to the assessment centers without a referral. So please make sure that you're either following the self-assessment first, or you're just calling telehealth. You can also call your primary care doctor, if you need to have more specific guidance in your situation as to what you should be doing. Okay. Again, please take a picture of these. These are reliable sources. You want to be careful where you're getting your information from. Don't rely on CNN, as much. These are probably the better resources where you can go in and get more reliable information. So again, please take a picture of that. Okay. So basically, our understanding of COVID-19 is rapidly changing. But one thing that doesn't change is the benefit that we all get from social support. Okay, so I know we're supposed to be keeping a distance apart right now, but talk to people, call them, FaceTime them, Skype with them. Don't try to just isolate yourself. It can be very lonely. Studies show time and time again that the more social support we have, the better prognosis we have in any illness. That is true for cancer, and that is true for any immune problem as well. Okay, so keeping that social support is so important for us to keep happy, and therefore a strong immune system, as well. Okay. Okay. So I'm a little bit over time, so if you need to go, please go ahead and go. I'm gonna go back to the questions and see if I can answer any more questions for those of you who can still stick around. Okay. So what if you are on thyroid medications for autoimmune issues? So hypothyroid, I'm assuming this is a question in regards to who's at risk. Again, just like with the hypertension, so if you have hypothyroidism can also suppress, it can also weaken your immune system. But if you're controlled with the medications, and if your numbers are where they need to be, TSH, free T4, and free T3, because free T3 is really important as well, then I don't think you would fall under the, people who are at risk, as long as you're controlled, with the medications. Can you please stress the importance of staying at home unless essential services or need groceries or meds? Yes, Dawn, thank you. So yeah, we should be staying at home. There's a lot of people who are not listening, to these recommendations. The only reasons why we should be going out is either to buy some groceries or to the pharmacy, or if you want to go out for a walk, you want to go out for a walk to exercise, not to socialize, in the park. So you want to, even if you're going out for a walk, right now we're still allowed to do that. I don't know if that's going to change, to be quite honest, but you do need to keep a safe distance, apart from everyone else, even when you're going out for walks. Is there a specific vitamin for low leukocytes? and I think Liz has left. But in case you listen to the recording, Liz, any of the supplements that I've mentioned, so far, and all of the dietary tips will help to improve the leukocyte levels. And of course, if you join us for the second part, I'm going to be talking more about different herbs and more supplements and the vitamin C, which would be really important in that case as well. Okay, how about getting out into the sun daily for 15 minutes between 11 and 2 to help naturally boost melatonin? I think the sun would give us more the vitamin D, Raisa. I'm going to talk about vitamin D again in the in next week. Although personally, I don't even think we get a whole lot of vitamin D from the sun. That's just my personal observation, working with people. Melatonin is actually suppressed, with the sunlight, and it's actually, and I should mention this, suppressed with blue light. So people who are not turning off their phones or who are not turning off their laptops, like for that half an hour or 1 hour before bedtime, that can be the reason why you're having a hard time getting into a deeper sleep. And it's because that blue light is equivalent to the 12 noon sunlight, and that can suppress, our melatonin levels. Okay. Okay, and I think we're done with the questions. So I think this was good. So I hope you found all this information helpful. Please stay tuned for an email going out if you want to hear the second part, of this presentation. Like I said, I'm going to continue discussing the different supplements that can be helpful, herbs, homeopathic remedies, and people who have allergies, what they should be doing, as well. If you have any more questions, there's my email address or my phone number here at the clinic. It's info@mynaturalclinic.com. If you're feeling overwhelmed and you have no idea which supplement to take, I am offering phone consultations as well. So please feel free to email me or call me, and we can set something up and we can try to figure out in your specific case what would make more sense. Okay. But until next week, thank you for joining me today. Hope you found this helpful, and I'll talk to you soon. This is the end of the webinar. Thank you.